Hello, and welcome to our two-part virtual program series on heart health in celebration of American Heart Month. My name is Melanie Harris, and I, along with Elizabeth Mandler, will be your co-host today. Before we turn it over to Dr. Hayes, I would like to remind you of a few things. Your microphone will be muted during this program today, and if you have any questions, we would love to answer them at the end of the program. You're just going to need to type your question into that Q&A tool that is on your screen. We also have a handful of resources for you to reference after today's program in the bottom panel in the left icon. So please be sure to check those out. And if you have any questions, don't hesitate to give us a call. Now, I am pleased to introduce to you Dr. Patricia Hayes, who is our Associate Medical Director in Texas. She is a double board certified physician specializing in internal medicine and pediatrics. She creates chronic disease management programs for conditions such as diabetes and high blood pressure. She enjoys traveling, dining out, and trying new restaurants and spending quality time with her family and friends. So now I will turn it over to Dr. Hayes.
Thank you, and thank you for that really kind introduction. I was just sadly thinking about when I wrote that I was doing a lot more traveling and dining out, and I'm not doing that during COVID. So hopefully soon, right, we'll get back to something a little closer to normal. But the reason we're here today is to talk to you all about your heart health. And so I'm going to review a little bit about what you'll learn today. So first off, we're going to talk about why heart health is important. We'll get into a little bit about high blood pressure, high cholesterol, and diabetes, and then do some tips to help keep your heart healthy. So first off, why is heart health important? Well, we all know that our heart is what keeps us running, keeps us moving, keeps us alive, and you only have one, so you want to take care of it. What your heart does basically is it's your circulatory system, and it helps supply oxygen and nutrients to your entire body. Unfortunately, we're not all taking great care of our health and our heart, and heart disease has become the leading cause of death in the United States. So let's talk a little bit about things that can go wrong. So usually as we age, our bodies and our hearts can continue to keep up just as well as a younger heart, but a diseased heart can't keep up. So what can happen to create that disease within our hearts? Atherosclerosis, or basically an hardening of the arteries inside and around our heart. Coronary artery disease, which is that atherosclerosis and hardening of the arteries, which can lead to heart attack and stroke. High blood pressure. We all know that high blood pressure can cause a big range of ailments, including heart disease. But to talk a little bit about just what is blood pressure. So it's basically the force of the blood that pushes against the walls of the artery. So as our heart beats and that blood is pushed through the arteries and into the veins, we get that kind of pressure that we can sense when you get that blood pressure checked in either your pharmacy or your doctor's office. But over time, if that blood pressure is too high, it can actually damage the heart and the blood vessels. But it's usually asymptomatic or no symptoms, so you don't feel anything. Which is what makes it so deadly and dangerous, is that oftentimes, unless you've been checked, you may not even know that you have high blood pressure until it's too late. So once you do go get it checked, it's good to be aware of what the different ranges and levels are for blood pressure, what's normal and what's not normal. And that's changed a little bit over the last few years. So starting with normal, that's typically less than 120/80. Once you get between a upper blood pressure of 120 to 129 and a lower blood pressure of above 80, you start to be in that elevated range. So that's when we would start to maybe worry and talk about ways to start preventing the progression of high blood pressure, or what we call hypertension. Once you get to that 130 over 130 to 139 over 80 to 89, you're actually in what we call stage 1 hypertension. And anything 140 or above and 90 or above on the lower or diastolic number is considered stage 2 hypertension. And so those are important to be aware of and talk to your doctor or your physician about. Because for some people, though, those are our markers of normal or elevated, your blood pressure goal may be a little bit different, but that's important to talk to your doctor about. So high cholesterol. So we talked earlier about those plaques and that buildup that can occur in our arteries. Well, cholesterol is one of those things that does that. So what is cholesterol? It's a waxy fat-like substance that's found in the body's bloodstreams and cells. So you do need cholesterol. And so some just normal amount of cholesterol is good for our bodies and helps us build up cells in our organs. But sometimes if we overeat and we have too much fat content in our diets, or just because of genetics and things that are hereditary, we can have excessive amounts of cholesterol. When that happens, it can build up in those arteries and cause those plaques that you see in that picture, and it can reduce the amount of blood flow, as we talked about earlier, which is so important to get those that oxygen and nutrients to the rest of your body. So definitely something that we want to be really careful about. And diabetes. Diabetes is another thing that contributes to heart disease if uncontrolled. And so that's a condition that develops when sugar levels in your blood get too high. So this is generally caused by a couple different reasons. For some people, it's because the body doesn't make enough insulin, and so that's generally regarded as what's called type 1 diabetes, or your body isn't using insulin properly, or you're what we call resistant to insulin, and that can happen sometimes with obesity or type 2 diabetes. Prediabetes is another type, and that's when the blood sugar levels are high, but we're not high enough to categorize or call you a diabetic. Over time, though, you can progress to diabetes if you're not careful with your diet and your exercise. So again, something to be aware of, because over time, high blood pressure, diabetes, and high cholesterol, as we mentioned before, can keep contributing to those plaques in those arteries and eventually maybe lead to heart attack or stroke. So we'll get into a little bit around how you can help keep your heart healthy. So we're going to talk a little bit about how to manage your health conditions, how to maintain a healthy weight, staying active, eating a heart-healthy diet, and avoiding smoking. So managing your health conditions. We've talked a little bit earlier about that, but the things that are dangerous, like high blood pressure, high cholesterol, and diabetes, we know have a negative impact, and it's really important that we screen for those things. So regular checkups with your doctor or your primary care provider to check for high blood pressure, high cholesterol, and diabetes are extremely important in preventing those long-term or even sometimes short-term effects that those conditions, if not treated, can have on your body. If you have any of those conditions, it's important to follow the guidance of your physician or your provider and just make sure that you're keeping up, again, with your regular checkups and maintaining adherence to your medications. Maintaining a healthy body weight. So we all know that being overweight or obese isn't good for your heart, but losing a little bit of weight can actually help. Most people don't know that sometimes even a 5 or 10% loss in your body weight can actually decrease your BMI to a point where you're within a healthy range and actually significantly decrease your blood pressure, your sugar levels, and also your cholesterol levels. So ways to maintain that healthy body weight: eating a healthy diet, watching your calorie intake, and being active. So getting out as much as we possibly can, just taking a walk, being an exercise class if you can manage it, and just being active and keep getting out there. And so we talked about getting active. What do people recommend? So cardiovascular or aerobic exercise is what's really important. You want to get that heart rate up a little bit as much as you can tolerate. Before you start any exercise program, it is good to talk to your PCP or your healthcare provider just to make sure that you're doing the type of exercise that you can handle and won't cause you any sort of issues. Generally speaking, as long as you're tolerating, you're not short of breath, you're not having any chest pain, you're doing a good job, because we want to get that heart rate up a little bit. Healthy diets. So what is considered a heart healthy diet? General rules are greens and vegetables and fruits, whole grains, looking for foods that are fat-free or low-fat dairy, and then that's kind of lean protein. So grilled chicken, grilled fish, and looking for foods that, are limited in saturated and trans fat, sodium or salt, and those like added sugars. If you see the high fructose corn syrups, you want to avoid those things. So looking at those packages when you purchase your food, taking a look at those cans, to checking out, what's in the food that you're eating is really important. And super important, avoiding smoking. So quitting smoking, we know, reduces your risk of heart disease immediately. It's actually pretty amazing. You can see improvements in people's health within minutes of quitting smoking. So if you're having trouble quitting smoking, talk to your primary care provider or your PCP. They can help you find out your motivation, get a support system, maybe find a replacement habit, and then try and keep yourself busy. So all recommendations that your PCP or ourselves here would have for you. And we certainly want you to quit smoking if you can. Let's review.
Thank you, Dr. Hayes. I jumped ahead to one of our slides with all of our references, but I appreciate your time today. We do have a couple questions that have come in from our audience and would love to ask you those. So audience, I'd like to remind you that if you have a question for Dr. Hayes, please put it into the Q&A area of the program, and we hopefully will get to it. And I'm going to go ahead and kick off our Q&A with a couple of the questions that we already have. So Dr. Hayes, why do you think that heart disease is the leading cause of death in the United States?
So I think over time, our societies have become less active. Food has been harder to acquire for some people. So eating healthy, we know, can sometimes be expensive, and it can be hard to find and purchase healthy foods in your community. So, that combination of not being able to stay healthy, eat healthy, be active has certainly contributed, as we mentioned earlier, to increased rates of heart disease in our communities and our populations. And hopefully these are things that we can help turn around in the future with the support of, primary care provider. We can help you access food, help you access exercise classes, talk about ways to stay active. We want to help change that statistic.
Thank you. And you mentioned that quitting smoking was so important for your heart health. After quitting smoking, what would you say is the next most important step that our patients and our audience can take to start walking down that path of heart health?
I think first and foremost, just knowing what conditions you may have. So we talked about the importance of getting screened and kind of knowing your health status. So, you may be somebody who has multiple conditions. And so our approach may be, a little different than we would have for somebody else who maybe just has diabetes or somebody who just has high blood pressure. So I think first and foremost, it's just getting in, being aware what's going on, how well controlled are you? Do you even have any of these conditions? And then getting that tailored approach from your primary care doctor to try and get you as healthy as possible.
Absolutely. You did mention that the quitting smoking, and I know that our physicians would love to help our audience and our patients achieve that goal. When somebody is considering quitting smoking, should they talk to their doctor first? And can we provide support and assistance if they are ready to make that change?
We absolutely can provide that type of support, and it's typically multidisciplinary. So we have lots of members of our team that can help support you in your journey to quit smoking. You don't always have to talk to your doctor first. There are, as mentioned, ways that maybe you can just through your own family support system, get a buddy, get somebody who will help you through it and really help encourage you to quit smoking, find other habits, try and replace the smoking with a healthier habit, like maybe walking or reading. And then, there are over-the-counter nicotine replacement options for people who want to try that. But if you're having trouble still, even with support and then over-the-counter products, we can see you in the office and help either prescribe at times, if you're a good candidate, medication that may help you quit smoking. And then we offer counseling and support through our behavioral health specialists that can help with motivation and encouragement and support to help you kind of break those habits that keep getting you back into smoking.
Excellent. Thank you, Dr. Hayes.
Mm-hmm.
How often should someone be screened for high blood pressure, their cholesterol levels, and their risk of diabetes?
And so that is typically risk-based. So, we look at things like your age and your weight and maybe your family history. And so sometimes the screening may be more frequent or less frequent depending on what your risk factors are. Generally speaking, blood pressure is yearly, and diabetes and high cholesterol is every 5 years unless you're high risk and we choose to screen more or at a higher frequency.
Great. Now, if someone does have type 2 diabetes, if they change their diet and lose some weight, can they reverse that? And what are the benefits besides just removing type 2 diabetes from their list of conditions that they might be faced with?
Yes, you can actually see pretty dramatic improvements. And when you get into that treatment place where I've seen people go from having extremely uncontrolled diabetes and making changes in, their diet, increasing their exercise, and maybe even only being on 1 or 2 medications and getting down into that pre-diabetic or non-diabetic ranges. So it's definitely possible. I don't always feel like even everyone needs medication. So it's important, again, to get those numbers, figure out where you're at with your diabetes and get a treatment plan tailored to you. But I tell people, don't get discouraged. I've seen tremendous improvements, with just some small changes. And again, as mentioned earlier, that reduction in your sugar levels helps that heart healthiness, make sure that you're reducing that opportunity for that plaque and that buildup in your arteries. And then, those changes that you're probably making to reduce your sugars, like eating healthy and exercising, and some of the medications can also help reduce your blood pressure and cholesterol as well. So all of these things work together to get us to a place of health.
Great. I have one last question for you, and this is a bit of a reminder. So we're reviewing this. If I were to go to a retail pharmacy location, a lot of them have services that can do blood pressure checks. Remind me of what a healthy blood pressure range is. So if I'm going to that corner pharmacy, when I hear those numbers, what number am I shooting for as an average?
Yeah, so generally speaking, anything under 130/80 is where we're shooting for. Even as you get above that 120 or 129 range in that top number, you start becoming in that elevated, but not yet high blood pressure or hypertensive range. So generally speaking, 130/80 is a good target to have for most people. But again, we want to tailor sometimes those goals to individual patients, because some patients will either have lower goals and some we may actually allow a little higher goals just to avoid anything like low blood pressure for them.
Excellent. Well, Dr. Hayes, I really appreciate your time today. I learned a lot. I think that I am going to go have my blood pressure checked and take a walk around the block or two to start improving my own heart health after hearing you talk about how important it is and the little things that we can start doing today to get us on that journey of long-term heart health. So thank you very much.
Thank you.
And I want to thank you both for being here today. I know that you are very busy, but I appreciate Dr. Hayes, your time on presenting to us about heart health, and Elizabeth, you being here to facilitate our Q&A, and to our audience. Thank you so much for joining us. As you know, for attending this program, you are eligible to enter our sweepstakes of a $65 gift card to HelloFresh. So thank you for attending, and you'll get another entry should you join us next week as we discuss, is your plate heart healthy? So please join us, and we look forward to hopefully seeing you in one of our centers soon. Thank you so much.
Thank you.